Likely you know that heart disease is the leading cause of death in both men and women in the United States. This disease can eventually lead to a life-threatening heart attack or stroke. There are several risk factors for heart disease, one of which is high blood cholesterol. Myth: it's not necessary to have your cholesterol levels checked until past the age of 50. Fact: the American Heart Association, AHA, advises children between ages 9 and 11 to check cholesterol levels once, then to check again between ages 17 and 21. Once a child is 20 and older, the AHA recommends that a person's primary care physician determine the frequency of rechecking cholesterol and other risk factors every 4 to 6 years if risk remains low. Myth: the only people at risk for high blood cholesterol are overweight or obese. Fact: it doesn't matter what body size or shape you have, as anyone can have high cholesterol levels. However, excess weight gain does increase your risk for high cholesterol, but being thin is not a protector either. Myth: my doctor has never mentioned getting my cholesterol checked, so I must be okay. Fact: the message here is to advocate for your health. If you are older than 20 and your cholesterol level has never been checked, ask your doctor to order a blood cholesterol check. That's why making healthy lifestyle changes are important for reducing your risk. Myth: only men have high cholesterol levels. Fact: wrong. Heart disease affects both men and women, especially after women go through menopause. AHA statistics show that each minute of each day, one woman dies from heart disease in the US. Myth: high cholesterol levels are always a result of poor food choices and physical inactivity. Fact: following a healthy diet and regular exercise do influence your cholesterol. But these risk factors are within your control. Many risk factors are out of your control, such as getting older and having a family history. Some people with high blood cholesterol have a condition called familial hypercholesterolemia. This condition is from a gene alteration passed from one or both parents. Myth: as long as you take medications for lowering cholesterol, you don't have to make lifestyle changes. Fact: prescribed cholesterol medication is important, however, combining a heart-healthy diet with regular exercise will significantly lower your risk of heart disease even further. Myth: the food label states, no cholesterol, so it must be a healthy food to eat. Fact: only foods of animal origin contain cholesterol. This means foods such as beef, poultry, fish, eggs, found only in the yolk, and cheese are animal food sources of cholesterol. No plant-based foods contain cholesterol. Always check the nutrition facts label to search for saturated fat and trans fat amounts per serving size of the food. Myth: it's best to avoid butter and use only margarine. Fact: first, it is unrealistic to give up butter entirely. Secondly, both butter and margarine have pros and cons. For instance, while it is true that butter contains artery-clogging saturated fat, margarine also contains unhealthy combinations of saturated and trans fats. If you do use margarine, the healthier choice is to stick with tub or liquid margarines. If you like more natural foods, butter is made from just 1 or 2 ingredients, cream and sometimes salt. So, the best advice is to save butter for special recipes and occasions and use it sparingly. Bottom line, use butter sparingly for special foods, and use either tub or liquid margarine also sparingly, and rarely use stick margarine.